feel? I feel excited. I feel great. It has been probably one of the easiest post-operative experiences I've ever had. Not that I've had that much surgery, but I've had sinuses and orthopedic surgery.
My name is Dr. Michael Obeng, and I'm live on Paul's Ghana.
And I just can't wait to see what I look like when I get the bandages off.
My specialty is plastic surgery. I'm a board-certified plastic surgeon. And to become a plastic surgeon, you have to learn about general surgery first, and then plastic surgery. And then after plastic surgery training, I'm also a microsurgeon. I'm a hand, wrist, and microneurovascular surgeon. What does that mean? I'm trained to be able to move tissue from one part of the body to another and do surgery under a microscope. So I do a lot of complex reconstruction. We call free flaps, okay? And I also do hand and extremity surgery. And I also do surgery on nerves to be able to restore nerves. I was born and raised in Ghana. I was born in Kumasi. I started off at a Kewa Methodist because I was born in Ashtown, Kumasi. I lived there until I was about 9. Then we moved to Adiababa, which is my village. And from that onwards, I went to Inshaiso International at P3, where I graduated in high school. And I was the school prefect. And from there, I went to Prempeh College. And from there, I went to the United States, where I attended the Midwestern State University for my undergrad, where I got a degree in chemistry with a minor in biology and mathematics. And from there, I graduated with honors. And from there, I went to medical school at the University of Texas, medical branch, the first medical school west of Mississippi. I also graduated with honors. And from there, I stayed on and did my plastic surgery training under the tutelage of Dr. Linda Phillips, Dr. David Herndon. And from there, I took a fellowship at Harvard, doing, of course, which is not approved in the United States or in most countries. They are getting silicone butt injections. I think that is falling out of favor because of the complications that we've seen over the course of the years. When you have this foreign body injected into your buttocks, you have a tendency to move around. You have a tendency to be encapsulated and form what's called a granuloma. These granulomas can be very painful. It causes destruction. I just saw a lady not too long ago from Atlanta, Georgia, who had it done, and now her buttocks is gone. Her buttocks is as hard as concrete, and it hurts. And so for those of you out there, okay, don't do that because that has a lot of health risk. There are other things you can do to augment the butt, of course, is putting an implant into it, but it also has a very high complication rate. The complication rate is up to about 25% to put implants into the buttocks. But now a lot of surgeons can do that as well, or they don't like to do it. And then, of course, the least and the most minimally invasive one is to inject fillers, which is safe. And most of these people are very skinny girls, models, who don't have any fat to be able to harvest, process, and then inject into the butt. These women will then go for the filler injection, and the most common filler being used right now is Sculptra. The advice I always tell the youth, put God first. Without the Almighty God, and so when I tell the youth, all the time, often at times, you blame before. Okay, and if you believe in that concept, you will never go anywhere. Okay, take responsibility for yourself. Dream. So Diane, because I'm still a dreamer. I have a bracelet that says dream and dream big. So Diane, always aspire something.